Hi, welcome. You're in the right place if you're here for the Birthly Newborn Care class. I'm going to introduce myself, but I just want to encourage you right as you're all signing in, if you have used or haven't used this format before for learning, it's pretty simple. You'll see down at the bottom of your screen, there's a Q&A button. You'll be able to ask questions as we go along. There's also a chat button, and if you want to press that and open up the chat bar on your screen, feel free to introduce yourself to each other in the class. My name is Jeanette Seelig, and I'm a postpartum doula and an educator and a lactation counselor out of New York City. So I am here to introduce a lot of different tools and tricks and tips for you around the subject of those first 12 weeks after your baby is born or brought home. But I'm going to move on and start talking about newborn care, just as long as I don't see any questions there. So again, feel free to interrupt me. We can go back to something too if you think of something that you didn't ask yet. Newborn care, oh, here I see one actually right now. Let's check on it. How often is tummy time recommended and the best time of day? That's a good question. And in fact, that's both parts of those questions are kind of important. Most pediatricians will tell you, and I think, you can always check with your pediatrician to see what they say because it does vary sometimes depending on who your doctor is. But most pediatricians will say you can start tummy time as soon as you want. And in fact, that very common baby on the chest with the parent reclining at about a 45-degree angle, that's very calming and soothing to babies. That counts as some tummy time in the earliest days because most babies don't want to be put down when they're just born on their stomach or on their back. We know they have to sleep on their back, but the tummy time is important so that they can move the other muscles. And most newborns have more neck strength than parents think they will. I almost always, when I work with a family in the home, they say, oh, they're so strong, but it's really more like most babies have a good neck clearing reflex where if they were face down, they'd be able to lift their head and turn their head to the side. So it's good to start tummy time whenever you like, but you should know that if you're setting them on a surface apart from you, tummy down, they're not going to be happy very long. So you probably won't do it for more than a couple of minutes, and you'll probably need to get right down at their level, in their face, smiling and encouraging them and trying to keep them happy for just a few minutes. I wouldn't stress out about tummy time in the earliest days, and if you find you're busy with other things and you forgot to do it, don't beat yourself up about it. But it's good to, try it whenever you feel like you have a calm moment, and then feel free to stop it when your baby is not having it anymore. And the best time of day, you'll find out what your baby's best time is, but often it'll be, maybe right after a diaper change when your baby has calmed down a little bit, or right after a feeding that your baby hasn't fallen asleep during, or in general, I would say a lot of babies start their day with more sort of social ability. It's better to front load your day if you have activities a lot of time, because babies do, like adults do too, and older children tend to sort of decompensate toward the end of the day. So if you can do it during those kind of mid-morning hours, sometimes parents will find their babies will be happiest during that time. But you'll kind of see, like, when's a moment that my baby isn't asleep, but also isn't super fussy. And again, the early weeks, you may not find very many chances like that during the day because you're doing so much feeding and your baby's doing so much sleeping. But tummy time is something that you can kind of like just figure out as you go along and try to do it whenever you think of it. And then don't worry if at the beginning it's not very much. Let's talk about baby skin, and I have another picture I'm going to show you. So when babies are born, you may have seen pictures if you've been in a birth class of they can be blue, they can look kind of mottled, they can have these kind of like bruisey looking spots on them depending on the color of their skin. So you'll see in this picture here, there's one with baby acne that tends to come and go from say 2 weeks old to 2 months old. Somewhere, you'll see spots, sometimes you won't see spots other times. The milia are those tiny little white bumps that you'll often see. And when adults get milia, they often stick around for a long time. So sometimes when adults see babies with milia, they think, oh no, they're going to have these white dots. But with babies, they tend to go away again very quickly. So I wouldn't worry about them sticking around for the long haul. Baby skin is sensitive, yes, but it also seems to sort of heal and renew pretty quickly. So you don't often see these things hanging around a long time. And the sloughing skin is also very common in their first month or so, especially around the ankles. But unless your pediatrician recommends it, I wouldn't use anything special on the skin. Just water is fine, and you can know that it's going to shift and change. If you think you're seeing something that looks like eczema, like a lot of redness and irritation and, you know, anything crusty, obviously, or anything like that, definitely talk to your pediatrician, because rarely that can happen. Babies can get eczema. But for the most part, the baby acne is usually within the range of normal. So in general, too, when people ask me about baby skincare products, we don't find that pediatricians and postpartum doulas recommend baby powder for diaper changes anymore. So really, if you have a very simple baby soap for bath time, and if you have some kind of simple baby lotion or coconut oil that you want to use when you do want to either massage or use a little bit of lotion on the skin after a bath or something like that, you don't need very much. And in the early days and weeks, especially when you're not giving very many baths anyway, because most people don't do daily baths at the beginning, both because of the umbilical cord and also because the baby has such dry skin anyway, you don't want to dry it out further. You may not be using much of anything at all, and you can even just be bathing with water. So I wouldn't worry about having too many products around. You'll kind of figure out as you go along. As your baby gets older, you may want more. So let's talk a little bit about diapering. And diapering's kind of a no-brainer. Even someone who's never put on a diaper can figure it out pretty quickly, but I do like to share a few little ideas about diapering kind of best practices. And you should know too that in the beginning your baby's going to be using they'll slowly ramp up to more diapers, and then they'll stay at sort of a high level for a while, and then they'll slowly ramp back down again as their digestive system and their eating and their bodies and, you know, all those sorts of things, you move closer to potty training. Let me show you a diapering demo real quick. And again, I know that you all can do this, and some of you may have done this already, but it's nice to show you like just a little bit of a tip. This is my baby doll. For, you know, expediency, this baby is wearing the diaper over the clothes. Obviously, that won't be your experience. But in general, the baby on the changing pad is probably not going to be happy. So you want diaper changes in the beginning. You know, eventually babies don't mind diaper changes so much. But in the beginning, they usually get pretty upset. Sometimes rolling the baby to the side to put a new diaper underneath before you take off the old diaper can help you contain messes, because a lot of babies will pee or poop, especially pee, as soon as you open the diaper, just because of the air temperature change. So you can open the diaper and then close it back up and give it a couple seconds and see if that baby pees again. You could even blow a little cool air. And I know that looks funny, but it can sometimes make the baby pee, and then you catch that in the old dirty diaper, and you don't have to go through 3 diapers at one change. If the diaper isn't completely full of poop, you can also use the old diaper as a wipe to pull it off like this, gather up the poop, sorry, that tape's sticking there, and then you've got a nice clean diaper underneath. You can finish wiping up the baby. And again, if you find your baby gets fussy getting their legs pulled up this way, you can roll them to the side a little bit. But in general, I guess I'll give you 2. You'll be rolling down the top of the diaper if you have disposables, or unless they have a cutout, just so that the umbilical stump doesn't get rubbed on too much. And then you'll pull the tape kind of tight, because these are stretchy at the top. And they can cross in the middle sometimes, depending on the size of your diaper versus the size of your baby. I don't know how well you can see that, but the tapes can touch or cross the middle, that's fine. And then the final thing to know is to pull out this ruffle on the leg. The diaper has a little ruffle on it usually, the disposables. And then if you pull it out, it will contain leaks better. So that's a good thing to do. And then as you pick your baby up after the change, then I would just check to make sure the diaper goes up the back, because you don't want it like accidentally folded down, because that can cause more leakage and messes. A nice thing to know about diaper changes is that as babies get used to them, a lot of times the diaper changing table becomes sort of a nice place to hang out with the baby for a few minutes, where they're actually pretty calm. And I don't know whether it's the shape of the diaper changing table, the pad that's usually on it, the curve, or whether it's that they like the change of scenery from where they normally are in the room. But for a lot of babies, that can even be a soothing technique when they get a little older and start liking the diaper changes.